Good morning. I'm Dr. Velasquez, Health Officer for Spokane County, and today I'm joined by our lead disease investigator for our HIV and STI division, Kirsten Duncan, who's here to answer a few questions about a topic that we've talked a lot about over the last couple of years. And the reason why we've talked about for the last couple of years is because we had seen a lot of cases, more than we had seen in past previous years. And the topic is syphilis. And someone told me or asked me, hey, is syphilis still a thing? And I went like, well, I don't know what you mean by a thing, but it is a disease that unfortunately is still present in the community. So with that preamble, tell us a little bit of where are we today and how does that compare to the last couple of years?
Sure. So syphilis has been steadily increasing in Spokane County since 2015.
Okay.
We saw a slight decrease in cases in 2020 and 2021, likely due to lack of access to routine health care, and just folks not going in and getting tested as regularly. And then starting in 2022, we saw a pretty significant surge in cases. So 2023, we reported our highest number of cases in the last 25 years.
Wow.
With a rate of around 69 cases per 100,000 people in the county. That was much higher than the state rate, which was around 51 per 100,000 people in Washington state. 2024 numbers are looking a little bit better, so we had about a 3% decrease in cases in 2024, but we're still reporting significant numbers of cases in our community.
Well, so I think a couple of important points. We did have an upward trend, slight maybe improvement. We don't want to call that a win yet, because rates do change a little bit.
Yes.
But one of the questions that people ask is, why are we seeing so many cases over the last few years? What's happened? Is anything different?
Yeah, so we think that what has been happening is that a different set of folks have been impacted by syphilis than in the past. So historically in Spokane County, syphilis was primarily impacting men who have sex with men, so our gay, bisexual, and other men who have sex with men population. And most of those cases were acquired outside of the county. Starting back in 2015, 2016, we saw it starting to spread locally. Within anyone that was having sex. So heterosexual folks, bisexual folks, and gay folks were all being impacted by syphilis in our county. And there are no national recommendations to test most sexually active individuals for syphilis. So it just wasn't something that was on people's radars. We weren't doing routine screening for individuals that were sexually active. And so it kind of took hold in our community. And syphilis is something that's really, really hard to identify, diagnose, and treat. And so that just adds a layer of complication. So most of the symptoms of syphilis look nearly identical to other more common health conditions. So someone might go to the doctor with a rash, and the doctor will say, maybe you changed soap or laundry detergent. Right. We'll give you some medication, a cream to help with that, and it should get better. And the rash for syphilis looks nearly identical and does resolve all by itself without any sort of medication. So people follow doctor's orders, the rash gets better, and they think that's what it was. I'm better. But in fact, we know that it likely was syphilis because later on they go get tested and it is positive. So syphilis in that regard can be missed for quite a while before we realize that the symptoms were likely syphilis. It also moves very slowly. So if someone has a new partner and they go in for testing maybe a week after they've had sex with someone new, if they were exposed to syphilis during that encounter, the syphilis test will be negative.
Right.
And it could be negative for up to 3 months after they've been exposed. So people get tested, it's negative, they think, I'm all good. I don't need to worry about this anymore. But in fact, the bacteria might still be in their body, might be what we call incubating. So it's replicating, but it's not yet symptomatic, and your test results aren't positive. So we do recommend for folks that think they might have been exposed that you get tested right away, but then get retested about 3 months later.
So I'm glad you brought that up because I think a lot of people have an image about syphilis that may or may not be accurate in terms of how it can present.
Yeah.
And how long it may take before exposure and actual symptoms of disease. So let's talk a little bit more about prevention in general terms. What can, and this goes to the point that Kristen just made, which is in the community. Many times we think is it just one group of people or another group of people, but now we do know that sexually active individuals could be at risk. So what can you tell us about prevention in general? What's the message for the community?
So the best thing to prevent syphilis is to be using barrier protection regularly for all types of sex, so oral, vaginal, and anal sex. And then we also encourage regular testing. Because so many of the symptoms are hard to notice, they're typically painless and can be hidden. Routine testing is really the best way to know whether or not you have syphilis. And treatment, as soon as you know, is also a good way to prevent other partners from acquiring syphilis. So those are kind of the big two things, using condoms and getting regular testing.
So let's talk about testing for a second. Where can people, so if I think, I don't know, where should I go for testing, which is a question people ask. Where do I go? What do I do? Who can help me with it? So maybe we can give them a little bit of guidance on that.
Yeah, so testing can be done at any healthcare provider.
Yeah.
So you can go see your primary care provider, you can go to an urgent care setting, or places like Planned Parenthood. All of that, those places can definitely do syphilis testing for you. It is a blood draw, so that's something that you want to keep in mind. If you're asking for STI testing, you want to make sure that your blood gets drawn, not just doing a swab or a urine collection.
Got it.
And the most health insurances will cover routine STI testing, so it should be covered by your insurance. And then if folks are having a hard time finding a good place to get testing, they can always reach out to our program here at SRHD to see if we can help them find additional resources.
Okay, and the contact information is on our website. People can go there and look it up. So folks, no excuse for not getting any testing, because if your provider cannot facilitate that for you or insurance will not cover it, contact us and we'll point you in the right direction. I know that we do that. So I knew the answer to that one, but I think it's important for everybody else to know the answer to that.
Yeah.
So one of the areas that we try to educate a little bit, because it's a complicated area, is congenital syphilis. As you pointed out, with appropriate treatment, you protect those around you. But syphilis does get transmitted in utero if person has not been tested and treated. And if I recall, we've seen kind of spikes on congenital syphilis. Tell us a little bit about that, and why is it important for us to really focus on that as much as we can?
Yeah, so unfortunately in Spokane last year we saw our highest number of congenital syphilis cases at 10, which doesn't sound like a big number, but every case of congenital syphilis is very, very concerning. It's easily preventable through testing of pregnant patients and early treatment in pregnancy. If the mom gets tested and treated early, there's almost no chance that the baby will go on to acquire syphilis. And congenital syphilis can be quite devastating. So if you have syphilis in pregnancy that doesn't get treated, between 20 and 30% of pregnancies can result in fetal demise or infant death in the first month of life. So very, very devastating. And then if infants survive, they can have really long-term health consequences such as blindness, deafness, other neurological deficits, and developmental delays. So very, very devastating for infants that are exposed. We do have treatment for infants that are born with syphilis, so they have a nice long 2-week stay in the hospital to get IV antibiotics. But we really try and prevent that as much as possible by identifying syphilis in pregnancy and getting it treated as early as we can. But unfortunately, in our county right now, we are seeing more of these cases than we would like. And And so we really urge healthcare providers and pregnant patients to get tested regularly. So the first time that you see a doctor when you're pregnant, you should be tested for syphilis. And then we do recommend that folks get tested again early in the third trimester and at delivery, just so that we know we're not missing anything and we can intervene as quickly as possible.
So those are the 3 key points during the pregnancy. So I think the message is, if you're pregnant, you know anybody that's pregnant, let's make sure that we're having this conversation with your provider, make sure that you know about it, and don't assume that I'm going to be okay, because we never know. And the good news is if we get it early enough, it can be treated, and we can probably prevent a lot of the sequelae for that child.
Definitely.
Including fetal demise and or early death. And those children that are born with congenital syphilis and survive the first year do have a number of issues, many times that are lifelong concerns. So good news is with testing and treatment,
Yes.
That 10 should be going to 0.
Yes.
Hopefully.
Hopefully.
That's a goal.
That's
0.
what we're hoping for, yes.
We're not going for like less than 10. We're going for like none over the next few years.
Yes.
So I think you've shared with the community a lot of important, I know we don't like to talk about syphilis and think like someone said at the beginning, is syphilis a thing? Well, it is. It is a disease, but the way you have to look at it is a disease like any other disease that can be transmitted, it's contagious, can be tested for, can be treated.
Correct.
So there's no reason if you have concerns or if you're not sure, not talk to your provider about it and say, hey, let me share with you my experience and maybe you can guide me, and your provider more than likely will get the appropriate testing and the treatment if it's necessary. And will also advise you about what to do with those around you, particularly your sexual partners,
Yes.
which is something very, very important. So I'm going to say, Kirsten, thank you very much for all that information. It is good to hear that there's been some slight improvement. I know that there's been a lot of effort on educating the community, and the best way to prevent is for us to have the information and the knowledge that we need and access to the testing and the treatment if necessary. So as we mentioned, go to our website. If you're not sure where to go, we'll point you in the right direction. Let's make sure that this slight downward trend really, really becomes like a cliff, goes like this. And very importantly, make sure that next year when we come back to give you an update, or a few months from now, we can say no congenital cases in Spokane. That's kind of like the news we're looking for. So with that, I'm going to say thank you to all. Stay safe. Be careful. Remember, it's hot out there. Be mindful of fires and wildfire smoke. And we'll see you again next week. Thank you for joining us. And thank you, Kirsten. And thank you to the team downstairs that really works on this pretty much every day, 365 days a year. So with that, we'll see you again next week. Thank you.